my brother and colleague, the Cabinet Secretary for Interior and National Administration. And I call him my brother because I have a few brothers in Cabinet by virtue of our history. He was a leader of majority in the Senate. I was the leader of majority in the National Assembly. The Deputy President was a leader of majority in the Senate. CS National Treasury was the leader of minority in the National Assembly, and CS Wandai. So we have some relationship. So thank you, my brother, for coming. The Deputy Chief of Head of Public Service, the Inspector General of Police and his two deputies, the DCI, the Commissioner General of Kenya Prison, the Secretary and Accounting Officer of the National Police Service, the Chairman of the National Police Service, and the CEO of Avenue Hospital, the CEOs of our referral hospitals, both public, private, and faith-based, the CEO of Social Health Authority, the CEO of Digital Health Agency, the management and the leadership and the staff of Avenue Healthcare, distinguished guests, ladies and gentlemen, good morning. Today marks a very monumental milestone in the realization of universal health coverage agenda under this administration. And we have gathered here to officially welcome the brave men and women of the National Police Service and the Kenya Prison Service into the Social Health Authority family through the launch of Usalama cover. On 1st of December 2025, we successfully transitioned over 400,000 teachers and their dependents into the Mwalimu cover under the Public Officers Medical Scheme Fund. And despite the sheer scale of that transition, SHA and Digital Health Agency, and I want to thank the CEOs and their staff, have demonstrated immense capacity in terms of processing hundreds of thousands of hospital visits, disbursing billions in claims, and today we are bringing that same robust, digitized, and efficient system to our uniformed officers. Before I delve into the specific of this cover, it is very crucial and critical to understand that the national context of health transformation we are spearheading as a country. The Social Health Authority is not a concept of the future. It is working, it is breathing, and it is highly effective reality today. And I want to say it for the avoidance of doubt. All former and presidents and vice presidents covered by the Social Health Authority. So if we cover you, then you cannot say SHA is not working. That I think has to come out very clear. Because I have one leader who his file is on the desk of the CEO of SHA and mine, who wants us to increase the benefits, which we shall do in looking at it. But and we are serving all former presidents and vice presidents, and I have given firm instructions to the CEO, and like other Kenyans, they must be served well. So it's not a matter of SHA as a concept, it's breathing and it's highly effective. Today, the rollout of the Taifa Care has been a resounding success. As of this morning, we have successfully registered over 30 million Kenyans, in fact, more specific, 30,269,902 Kenyans into the SHA digital platform. And I'm sure the CEO can even tell us Since we came here, how many Kenyans have used their phones and have registered as members of the Social Health Authority? The sheer volume of service delivery is staggering, and a total of 166 billion 440 million 988,360 in claims have been submitted by healthcare facilities across our country. And let me break it down, because numbers don't lie and numbers are very stubborn. Let me break down our success story on claims management. We have now successfully disbursed cumulatively a total of 125 billion to healthcare facilities across the Republic. And the chairman of Avenue Healthcare. Blame us on anything else, but we will pay. If your claim is right, if all the documents are in place, the CEO has money as we speak here, and she'll pay you. But if your claims are rejection, if your claims, some documentation are missing, for example, you have done a maternity here, and you say one of our police officers has delivered in this facility, and a critical document called birth notification is missing in your claim form, SHA will not pay. So you must have the right men and women in all our facilities to do the claims. And a good example, Minister, is that even when the minister or myself or anybody goes to a facility, the claim form is a legal document. The first part of the claim form is filled by the patient. The middle part is filled by the doctor. And the last part is filled by the administrator. If you bring a claim form filled by one person, one handwriting, one biro pen, we will not pay. The system will reject. This is not NHIF. This is SHA. So you must have a complete mindset. The way NHIF used to work and the way SHA works is world difference. In fact, that's why they're twins, the SHA CEO and the CEO of Digital Health. So these massive financial injections we have put in the last 19 months have been again distributed equitably across all facility ownership models. So we don't discriminate whether it is faith-based, public, or private. The entire health ecosystem remains fully capitalized and capable of offering uninterrupted service to our Kenyans. And for today, any of our officers, their health, in fact, is so important, is part of our national security agenda. When they're very healthy, and Minister and the IG and your team, I want to assure you that as I take care of the health of the people of Kenya, I will personally take responsibility to make sure this Usalama cover works and works for our people. Because they are the ones who keep us safe, they are the ones who keep safe our country, the men and women. And I'm speaking as a former Minister for Defense. Many people don't know what the men and women in our security sector do. Your health and the health of your children is going to be a key priority for not only the leadership at SHA and the staff, but at MOH. So how did we disburse money? Since the last 19 months, or somebody else said about 90 billion. County governments, so far in the last 19 months, hospitals in our county governments have received over 34 billion. Faith-based organizations and hospitals run by our good people, and I really like the sister who says that they offer both care. And that's why today, if you go to Kenyatta, you'll find a chaplain and you'll find an imam. Because there is what the doctor will do for you, and there is that spiritual nourishment. You must combine both. So faith-based facilities, we have paid them 19 billion. Private healthcare facilities, including Avenue, where we have paid you 62 billion. Our national referral hospitals, we have paid them 10 billion. While we celebrate these payments, the system is actively processing the remaining balance. Claims currently awaiting payment are undergoing a very vigorous verification process. Simultaneously, our digital system have effectively flagged and rejected claims that do not meet stringent medical and administrative criteria, actively safeguarding public funds from waste and fraud. This is an irrefutable proof that SHA is working. For far too long, our police and prison officers have suffered indignities at the hands of private commercial insurance providers. We have heard the heartbreaking stories of officers injured in the line of duty, putting their lives on the line for our safety, only to be turned away at the hospital reception. We have seen them subjected to endless red tape, arbitrary calm rejections, and the extortion of out-of-pocket co-payments by profit-driven schemes that give priority to the bottom line over the lives of our officers. And by transitioning our officers to Usalama cover under SHA, we're implementing government-to-government solution that give priority to care, to dignity, and to efficiency. The contract we have signed for Usalama cover is not a basic package. It is an enhanced, highly comprehensive matrix designed specifically for the unique risk and the needs of our disciplined forces. Under this cover, we guarantee the following for our 138,283 officers and their dependents. Number one, we guarantee you comprehensive primary and specialized care, from primary health care at our dispensaries to the highest level of our specialized care at level 6 National Referral Hospital, which are represented here today from all the three categories: faith-based, private, where we are today is at level 6, and our public referral hospitals. We are also promising to provide with you specialized treatment. As Dr. Mercy has said, the package covers advanced chronic disease management, specialized surgical procedures, notably comprehensive fertility treatment, including their own families. We're also providing you with overseas treatment. For instance, where specialized care is not available locally, the Usalama cover officially includes an overseas treatment benefit, ensuring our officers have access to the best medical interventions globally. We are also offering the last expense benefit. We recognize the ultimate sacrifice of our officers they make. SHA has established a prompt and a seamless claims process for the last expense benefit, ensuring families receive immediate financial support during their most difficult times. We are also offering you ex gratia management framework. We have formalized a structured extra gratia management framework. This will ensure that officers facing catastrophic health financial burdens that exceed their standard limits have a vetted pathway to receive compassionate financial coverage directly from SHA. We are also offering you zero co-payments, and let me be very, very clear here to all our contracted healthcare providers, including our host today at the Avenue Hospital. Co-payments and out-of-pocket cash demands from our members are strictly forbidden. Any facility found demanding cash from our officers for covered services will be cited for breach of contract. They will face immediate suspension, and they will be compelled to issue full refund. So if you come to a hospital and your benefits are there and they ask you to pay out of pocket cash, those facilities will be cited for breach of contract. We will suspend them and they will be compelled to return the full refund. Through the DHA, we have established a seamless digital health superhighway. The days of carrying bulky files or being denied care due to missing physical paper are over in our country. However, with this robust digital system comes very rigorous oversight. The DHA system that we have put in place is actively flagging fraudulent claims to any rogue elements within the health facilities who think they can collude to defraud this fund. We are warning you. We have zero tolerance policy. If you attempt to steal public money meant for the healthcare and other Kenyans, you will be arrested, you will be prosecuted, and your facility will permanently be closed. The DCI has, through a couple of files, the ODPP has a couple of files, and many have been taken to court. Finally, a benefit is only useful if the beneficiary knows how to use it. Therefore, I'm pleased to announce that SHA and DHA, in coordination with the leadership of the National Police Service and the Kenya Prison Service, will immediately commence a nationwide sensitization campaign. We will reach every officer across the country to educate them on their enhanced and how to navigate the patient portal. And I want to take a moment here to sincerely thank the organized this scheme, led by the Deputy Chief of Staff, the CEO of SHA, the CEO of DHA, my PS who's away today, Banis and her team, from both the from the IG's office and the Ministry of Interior. I also want to take a moment to sincerely thank the management, be they public, private, and faith-based. So I say, the way I go to Kenyatta and Moi Teaching County is the way I went to Tenwek, and the way I'll go to Mutumu in Yeri, and the way I've gone to Aga Khan, and now Avenue is our choice. And so I really want to thank the management and the staff and the leadership for hosting us, for inviting SHA team to showcase how this new system works, but to our uniformed officers without discrimination. And I want to say it personally, as a Minister for Health, I am very, very proud of Avenue for what I have been shown today, the capacity, the leadership, the doctors, the nurses, the equipment. I think I need to come back here another day when I'm free so that you do for me a more better presentation. But thank you. It was good to see what you offer. A clap for Avenue. To our level 6 CEOs who are here and all our healthcare providers, please, humbly, I urge you to treat our uniform officers with the dignity they deserve. SHA is fully capitalized, committed to the timely settlement of your genuine claims. To our officers, the Ministry of Health stands with our nation and our security. So as the Minister for Health, as Honorable Burkomen and the IG and the team protect our country, I have a duty to protect, under this ministry, protect your health and that of your families. Just in conclusion, We are talking to your former provider to give us, Minister, and you'll help me, to give us the database of your dependents. He has given us only 50,000, am I right? But that provider, I have spoken to him, the CEO myself, and we have given him until Tuesday. That data doesn't belong to him. That data belongs to the National Police Service, and it belongs to the Kenya Prison Service. Doesn't belong to him. I'm sure me and the minister know the Data Protection Act. So we are asking him so that SHA does not spend more time looking for, and our security men and women to give us your dependents. We must start from somewhere. So the previous database we will have, then we keep on updating the data. Please, your minister has said from 800 facilities, now you have over 6,000. And Minister, I have been to a number of private public hospitals, and we have agreed in principle, even here, the way they have done. We must have dedicated lines and clinics for the National Police Service and the Kenya Prison, whether it's Kenyatta or KUTRH or MATA, and thank you, the CEO, ma'am of MATA, or Nairobi West Hospital. Nairobi West Hospital, I think, is very popular with the police. Please go there. Nobody will stop you. There are some who are saying, don't listen to them. Oh, they are owned by this. But the owners of Nairobi Hospital West are here. The owners of Avenue are here. The CEO of Kenyatta National Hospital is owned by us, government. Yeah. So don't listen to the naysayers. Some of them, they are our clients. It's very hard to reply to your client because they pay me. Or the retirement benefits package pays us. So health is very essential. Finally, emergency, there is a fund called Emergency, Chronic and Critical Fund. And we are going to establish an ambulance dispatch center. I don't know whether the ambulance systems of Avenue Hospital have been embodied. That any Kenyan, anywhere in our country, who will face with an emergency going forward under that fund,